Partnered by Time's Influence.
Hello and welcome to the special show, Win Over Heart Failure, Keep It Pumping, brought to you by Novartis, only on Times Now. Now we are here to discuss the issues surrounding and some of the myths surrounding heart failure. When one thinks of heart failure, one automatically thinks of heart attacks. But the two are actually completely different. And why is it important that you should know about the difference? Well, let's find out exactly what is this notion of heart failure, how it's impacting a larger number of Indians. The number is growing every year, and it is something that you and I should be concerned about because it could be knocking at our doorstep. To discuss this current ailment of heart failure, let's bring on board some of the biggest names from the world of cardiology, and it gives me great pleasure to introduce them to you on the show. Dr. Ramakant Panda, who is the Vice Chairman and Managing Director as well as Chief Consultant for Cardiovascular Thoracic Surgery at the Asian Heart Institute. Dr. Panda, thank you so much for joining us. And Dr. A.V. Ganesh Kumar, who is the Head Department of Cardiology and Chief Interventional Cardiologist at Dr. L.H. Hiranandani Hospital, along with many more accolades to your name. Thank you so much, Dr. Kumar, for joining us. So I gave a very brief introduction, doctors, as far as heart failure is concerned, because it's been a learning to me as well. The minute I heard about heart failure, I said, my goodness, does this mean it's an end of the case scenario? Let me start with you, Dr. Kumar. When one talks about heart failure, what exactly is it?
I mean, heart failure by itself is not a disease. It's a sequelae of various cardiac diseases. Okay, so when you have among the cardiac diseases, the one thing that stands out is the coronary artery disease. Right. Okay, in a layman's language, the blockages that comes inside the arteries which supply the muscles of the heart. Okay, if these blockages go on to trouble a person in the form of a heart attack, okay, and if the treatment is not taken at the right time, or even if it is taken and a person continues to suffer time and again new blockages and keeps on damaging the heart, eventually the pumping of the heart goes down.
And that constitutes a heart failure.
So when the pumping goes down, it has its own symptoms. The body is not able to, the heart is not able to commiserate with the needs of the body.
Okay.
Right? So that is heart failure.
Okay, so essentially you mentioned a very important point. It is not a disease per se. It is an outcome of repeated damage to the heart. But why is it, Dr. Panda, that heart failure per se is important to consider, especially at this point in time?
Because the incidence is going up very high. And second thing equally important is that by the time you get the symptoms of heart failure, it's too late. The diseases, as Dr. Ganesh Kumar said, that leads to the heart disease has already have inside the person's body for 10, 15, 20 years. So by the time you get symptoms, it's the end result of the diseases that cause the symptoms. So it is too late, because by the time you get symptoms of heart failure, your survival time goes down. By the time 50% people will die within 5 years. So it's too late. But the disease starts 10, 15, 20 years before. It's very important to know about it so that you prevent. If you have any of those prerequisite diseases that cause this problem, by the time you should be diagnosed 10, 15, 20 years before, or even 10 years before that, you take preventive measures to prevent that.
Important thing you mentioned is it's actually like a silent killer. The changes are happening in your body.
Yes, yes.
So what are those red flags? What are the diseases which are associated or makes me more vulnerable to heart failure?
Okay, so there are risk factors for a heart disease. Amongst the most commonest heart disease, even in India now we are talking, which is in the rising trend, is a coronary artery disease, also called as ischemic heart disease. Right? The risk factors amongst the top is a lifestyle itself. Right? The lifestyle, obesity, okay, which we call it as metabolic syndromes, associated with diabetes, standalone diabetes, or with hypertension, add on smoking. Okay, so all these things are risk factors for initiating a process of heart disease.
So if I'm, for any of our viewers watching, if you're smoking, you have diabetes and you have hypertension, does this make for a potent mix for heart failure?
Yes, absolutely. See, again, if you look at the 100 patients who get heart failure, probably 40-50 out of that will be patients who have got what Ganesh Kumar said, is patients with heart blockage, coronary artery disease. 25% will be high blood pressures who are not treated properly over long years. Diabetes, another 5-10%. So 80% are lifestyle related.
At the same time, if say I am a young person in my 20s or 30s, I'm reasonably fit, I may have borderline diabetes, I may have a bit of a tummy which is popping out, which is the case with many of us. Do I need to really press the alarm bell? Do I need to go ahead and get myself checked? Aren't we being a little too alarmist?
No, not, I mean, yes and no, because see, as Indians or subcontinent per se, we have a tendency to develop the disease in a more aggressive manner and much earlier than the Caucasians from the West. Okay, so we end up having heart disease 10 years or 15 years earlier than the Western population. Okay, and even it presents in a more severe way. So when you say I am 25 and I am doing good, well, you are doing good, that's a good thing. But not all 25s and 30s are doing good. Okay, here I come to a point what is called as metabolic syndrome, right? We have 20 million Indians, fellow Indians with metabolic syndromes today. Grossly put, it is obesity. I will not go into the depth of metabolic syndrome. Grossly put is obesity, overweight, right? And it's going to be almost 70 million by 2025.
So when you say obesity, one has this vision of, somebody really overweight, one really thinks of images of
not necessarily,
in
not
the US,
necessarily.
yes, exactly.
See, you have to look at also the Western population. If you see their body mass, the muscle mass is much higher than the fat. The same BMI that is considered 25 considered overweight. For Indians, it's probably 20, because at 25, it has been seen that muscle mass of Indians is much less, fat content is more.
Right.
So that even 25 or 26 is fairly high for Indians.
So I needn't be grossly overweight to qualify to being obese.
You don't have to be grossly overweight, because a large number of fat in the abdomen area also can equally cause problem.
So in your 20s and 30s, changes in your lifestyle can actually pull you back from the brink of heart failure. Is that correct?
Absolutely.
Okay.
Absolutely.
What happens if I get the wake-up call later? Say I'm in my mid-40s, I'm a stressed executive, which pretty much applies to most of us, and I have that unhealthy lifestyle. One doesn't automatically think of heart failure. One thinks usually, okay, maybe diabetes, the dreaded heart attack. Explain to us the difference between a heart attack and heart failure.
Okay, so heart attack per se is sudden occlusion of an artery. With these lifestyle things that we spoke, the diabetes and smoking and hypertension, obesity, gradually there is a cholesterol that gets deposited into the lining of this inner lining of the blood vessels. These plaques eventually progress into a minor plaques to a moderate occlusions to a severe occlusions, and sometimes even a mild to moderate occlusions can suddenly break. A severe form of stress, physical, emotional, you're doing some unusual activity, these plaques can rupture. When they rupture, the plaques get exposed to the free flowing blood inside the vessels.
And they sort of block the flow.
They suddenly block the artery, so the blood supply to that part of the heart suffers.
So
the heart gets damaged.
So that's a heart attack.
Heart attack. Heart attack means a part of the heart muscle damage. Heart failure means the entire heart is not able to pump blood to the body. So it's not able to, that's the reason less blood goes to the whole body. So that's where you get the symptoms. As you said earlier, heart failure is not a disease. So it is a end result of multiple diseases that make the heart to fail to do its function, which is supplying blood to the body. Okay. Heart attack is an acute event. Suddenly something happened where the artery that supplies blood to the heart, because heart itself also need blood supply to survive, to function. So part of the heart muscles get damaged because one of the artery suddenly gets blocked.
So
it's an acute event. Acute event is a heart attack. So people should differentiate heart attack from heart failure. Multiple heart attacks, a single major heart attack can lead to heart failure.
If I get a heart attack and if it's a mild one, it's almost like red flagging the fact that I could be headed towards heart failure, but it can also be a silent move towards heart failure.
Let's add something to this. Not all heart attacks will lead to heart failure. Okay. So when you get a heart attack, and if you are treated at the right time, you don't necessarily have to go into a heart failure. The problem comes when you don't identify the heart attack, or you take the treatment of heart attack in a delayed manner.
Right.
Okay, there is a specific period of time when you should be attended. Okay, that's called the golden hour or the gold. So at that particular point of time, within the first 3 hours or 6 hours, you are able to restore the blood flow.
Right.
You will not end up in a heart failure.
Talk about why it's also important to focus on heart failure from the cost of managing the disease, because the outcome of not managing heart disease is clearly a very expensive one, Dr. Kumar.
I mean, heart failure eventually robs you from going to work. You will not be able to go to work and do your work, right? So that translates into an economic burden for the country, for the society, right? And almost 25% of the people are less than 50 years of age who are having heart failures now. So, I mean, we are almost looking at 8 to 10 million heart failure patients in India. Globally, there are almost 30 million people. So, 8 to 10 million people taking heart failure treatment and not going to work, okay, translates into a loss of almost $230 billion US dollars over last 10 years, which is like 1% of GDP. So the loss of work you see today, we are talking about 9 million years of loss of work in India, which is almost 6 times that of America. So they are taking measures, I mean, and you wait for another decade, it will be almost 18 million years of loss of work in India.
Because of
not able to go for work. Right. Because you are a working population and you are down with heart failure.
And ironically, actually, I can mitigate some of those costs the earlier I go and earlier I come to you.
Largest thing can prevent the entire economic burden on the patient, on the family, and in the society as a whole.
By just coming early enough.
By just diagnosing early enough or leading a preventive lifestyle, which can be built in. It's not something you have to completely go out of your day-to-day activities. Just building as simple as doing exercise every day 30 minutes, not taking the lift, just climbing up the steps, building some amount of physical activity, cutting down the salt. It has seen that just cutting down the salt by 2 or 3 gram a day reduces almost 100,000 people who will not die in a year. 100,000 people, 1 lakh people will not get a heart attack.
We all like our
as
salt
simple as
in our
just
diet.
taking little less salt in the diet. Those things you can easily build in your lifestyle.
So it is indeed a very critical issue to look at, the cost of ignoring heart failure and its symptoms.
Is a issue to the state. I mean, it's a social issue and a issue to the state. I mean, economic burden.
What are these symptoms?
So heart attack, when you get classic, is you get a chest pain, you get sweating, vomiting, that kind of symptoms. It's acute event, you go to the doctors, immediately show to you. Heart failure, on the other hand, is very slow process. So the commonest things you can get is a lack of appetite, lethargy, tiredness, weakness, and that slowly progresses to swelling of the body. Sometimes you may not get any symptoms except just swelling of the leg or body, and that slowly progresses to heart failure. As I said, heart failure is a slow chronic event. So heart is not able to function properly.
Actually, these are symptoms that can apply to anything.
Lot
You know,
of
I
other
have
things,
swollen
yes.
ankles.
But you have to associate with, you have got pre-existing problems.
Give us an example, Dr. Kumar. Say I'm a healthy patient. Well, I think I'm healthy, but and I start experiencing fatigue. How would I really sort of notice that? Would it be a change in my daily activities, like say walking a few paces gives me exhaustion? How dramatic would it be in terms of my daily life conditions?
One is if you have any preceding risk factors, like if you are a diabetic, hypertensive, smoker, you need to be more alert. If there has been a previous cardiac event, okay, treated or untreated, then you need to think in terms of you.
So would it typically, is fatigue a symptom that I would experience? My first symptom would be
Yes,
one
I
of
mean you have
fatigue?
been doing, say, every morning you have been taking a 3 kilometers walk, and now suddenly you realize over a period of last 6 months you are not even able to cover 1 kilometer.
A feeling of malaise which is building up?
It's more of an insidious slow process symptoms,
Right.
whereas heart attack is a very acute thing. And quite often you can get mixed up with the lungs. Heart and lungs are interrelated.
Yes,
so
exactly.
quite often, so basically what you are saying, those who already got pre-existing heart problem or high risk of getting heart problem, if they get this symptom, they should, first suspect heart. Of course, you need to check out the lungs also.
Okay, let's take a quick break on that note. It's been very illuminating. I think I'm beginning to understand, and I hope our viewers are as well, as to what constitutes heart failure, how it's very different from heart attack, and how you need to keep those important markers in mind in terms of pre-existing illnesses that you already might be having when it comes to heart failure. You're watching our special show, Win Over Heart Failure, Keep It Pumping. We're in conversation with some of the biggest names in the world of cardiology. We'll take a short break, but come back with answers. What are the options you have if you are diagnosed with heart failure? Science indeed is giving us fresh breakthroughs. We'll come back with all those answers and more. Stay with us. Welcome back to Novartis Presents Win Over Heart Failure, Keep It Pumping, where we are in conversation with Dr. Ramakant Panda and Dr. Ganesh Kumar. And before the break, we were discussing what exactly constitutes the symptoms towards heart failure. But in case you are getting those symptoms, which may be fairly incipient symptoms which could apply to anything, sensation of fatigue or a loss of appetite, feeling breathless doing the same activities. However, in case you feel worried by some of these and you already have a pre-existing condition, what are the tests you need to conduct? What are the questions you need to ask your doctors? Dr. Panda, you're right here. We have the opportunity to ask you that very question. If I'm coming to you saying that I'm really not feeling quite up to it and I have a history of diabetes, I have a history of hypertension, what would you advise me in terms of tests?
Especially if you already got existing, pre-existing condition leading to heart disease, the very basic things one can check it out. One is do a thorough physical examination of the patient that itself will point out certain heart related problem. Doctor can check out the patient properly to see whether the heart related the problem is because of heart or could be because of lungs also, that can cause the same thing. And then next you do a battery of investigation. Investigation as simple as an ECG, X-ray chest. ECG it will show up, suppose the person has got already heart attack in the past, it will show up on the ECG. X-ray also show up the heart size has enlarged, if that water collection in the lungs it will show up. Then the further specialized investigation, today an echocardiogram of the heart, which is very easy to do. Almost every small little nursing home or doctor's office they have a echocardiogram. Echocardiogram will show up what is the heart pumping, because normal the heart pumping is more than 55% or 60% efficiency it works. So if it is lesser than that, whether the enlargement of the heart, if you ask me, the simplest and the one of the easiest diagnostic tool that can check out will be the echocardiogram. Then further test will be an MRI of the heart, you can do a CT scan or you can do thallium scan, then
so
angiogram.
There are plenty of options.
I mean, look, echo is basically an ultrasound of the heart, right? And I'm not asking a young 30 years old person to do an echo without any symptoms. You're saying if there are symptoms, right?
It's a symptoms with pre-existing heart problem.
Okay.
Right. So I don't want to send a wrong message that every 30 years old should go and do an echo. No.
Right.
Okay. At the same time, I mean, if the symptoms of suspected heart failure is there, yes, for sure, your doctor recommends that. Okay, because heart failure symptoms mimic with many other conditions like lung diseases, kidney diseases, liver diseases, because swelling of ankles can come in these diseases too. A simple thing like an anemia, a grossly hemoglobin of 6 gram % or 8 gram % can come with swelling of ankles. That's not heart failure.
Now, we've been talking a lot about the young and the old and how the profile is changing. What about between men and women? Because, you know, when one thinks of heart attacks, unfortunately, the documented cases seem to be more of men than of women. Or is this just another myth to be broken?
It's not really a myth. What happens in women, as long as they are having their periods on till the age of mid-40s, the hormones do protect the heart, and it's a fact.
So till menopause?
Yeah, till menopause. But it's not a hard and fast rule. So women have taken into more of smoking now. Okay, you see a lot of women smoking.
So women are equally at risk?
The smokers.
Okay.
Yeah, I mean, men, a 35 years old man and a 35 years old woman, man will definitely have more risk for a heart disease.
Okay, let's talk about treatment because that's obviously the crux of things. As doctors today, where does treatment stand when it comes to heart failure? If I have been diagnosed with heart failure, is it in that sense a death knell? I've got 5 good years of my life left or 10 good years of my life left. Is it as definite as that?
I mean, everybody gets profiled. We profile a heart failure patient, right? I mean, first we have to identify the cause of heart failure. Okay, there are some treatable causes of heart failure and then non-treatable causes of heart failure. For example, if it is because of blockages in the arteries of the heart, which has reduced pumping, right? If you get rid of the blockages and if the muscles are still viable, it picks up.
So is my first option, when you say treatable options and removing the blockages, is that in that sense my first option is surgical intervention?
No. First you diagnose the cause that caused the heart problem.
Okay.
So, yeah, as I said, 50% times it is the blockages in the heart arteries. If it's blockages, then you have treatment. One is medical treatment. You have to understand that medical treatment is the most important part of heart treatment. Angioplasty or surgery forms the secondary treatment. Large number of patients can be treated with medicine. So, first you diagnose the problem. If it is a blockages, you treat the blockages. If there is high blood pressure, the person is not treating himself properly, herself properly, then see that your blood pressure is very well treated. Do that, and then you do the others.
So identify the cause,
yes,
and my
that.
first line of option is drug therapy.
Medication,
now,
yes.
for instance, when we discuss diabetes, because the two seem to be going hand in hand, there have been some new breakthrough treatments. What's the state of research and development when it comes to drug therapies which are available now for heart failure patients? Have there been some breakthrough treatments?
I mean, the last set of medications that actually made a difference as far as mortality is concerned. That mortality means making a difference in mortality means increasing the lifespan of a person when you take these medications, are something called as beta blockers and ACE inhibitors or ARBs.
Right.
These are a group of drugs which are also used for blood pressure, but they're also used for heart failure. This was way back in early 90s.
Right.
A beta blocker making a difference as far as the lifespan is concerned. An ACE inhibitor or ARBs can increase the lifespan. It took almost 20-25 years, and there are new drugs which have come now which improves the mortality by almost 20%.
Right.
So there are new drugs which have come which is called ARNI, or there are some medications like a better form of ACE and ARBs. Okay, so there have been breakthroughs in medications alone. So once you are on right medications for heart failure, many patients improve. Their mortality rates come down.
So I think the important aspect here is when it comes to treatment, you have drugs available, and hence these are drugs that one has to take regularly. It does not necessarily mean straight away surgery.
No.
That's again a critical difference between heart attack and heart failure.
Yes.
People on drugs also, you continue to have what is called as class 3 or class 4 symptoms. Class 3 means you're not able to take even your bath. Okay, from going from one room to another room is a problem for you. You will be breathless. You're not able to sleep the whole night. That is class 4. I mean, you're just sitting and you're breathless.
Right.
And you're on full medications, right? Then there are some devices like
There's some special type of pacemakers
devices.
So there are a lot of options. I think the
Yes.
important message, doctors, is that one needs to take timely action, one needs to take the correct action, and heart failure is not a death sentence. Indeed, it is. It is a condition that needs to be managed.
Yes.
Right. We've completely run out of time. We've discussed a lot of very important issues, and most importantly delineated the difference between a heart attack and heart failure, and indeed what are the options that are available. That brings us to the end of this special show brought to you by Novartis on winning over heart failure. Keep it pumping. We hope it brought you as many insights as it did to me, because indeed heart failure is a condition that can be managed. There are many options on board. One needs to be alert, and one needs to watch out for all those symptoms which could be building up. Thank you, doctors, for sparing your precious time. Thank you to all of you for joining us on this special show.